Diseases in farm animals. Hepatitis E virus. Hepaviridae is a part of orthohepavirinae. They affect terrestrial mammals. They are single-strand RNA viruses and they're non-enveloped, which means they have very good resistance in the environment. They cause infection through the oral route by eating food. They're very resistant viruses and have a high replication rate. Genetically, they are stenoxin. The zoonotic agents are hepatitis E virus 3 and hepatitis E virus 4 and hepatitis E virus C1. Hepatitis E virus C1 is found in rats and they can transmit the disease to humans. The virus is pH resistant and it takes about 70 degrees Celsius for 5 minutes to destroy the virus. It is a good antigen and it's found worldwide. It has many genotype species. Hepatitis E viruses can cause disease in pigs and rabbits. The causative agent is Palsa hepivirus baliani, which is part of the Palsa hepivirus genus. The occurrence is worldwide. There's genotype species. Hepatitis E virus 1 and hepatitis E virus 2 are found in poor sanitary regions. These can only infect humans. Hepatitis E virus 3 and hepatitis E virus 4 are found in developed countries. These have a veterinary importance, as they are a zoonotic disease coming from infected animals. So for the etiology of the disease, the Palsa hepivirus genus has the Palsa hepivirus baliani. It has a genotype 1 to 8. But we mostly look at hepatitis E virus 1, 2, 3, and 4. For the epidemiology of the disease, it's shed in animal feces and its uptake is orally. This is through contamination of food. So for the sources of human infection, in hepatitis E virus 1 and 2, it's through contaminated sewage. And in hepatitis E virus 3 and 4, it's from pork products and vegetables through contaminated water. The host for hepatitis E virus 3 are pigs, wild boar, deer, rabbits, and humans. And the host for hepatitis E virus 4 are pigs, wild boar, and humans. So for the pathogenesis of the disease, in animals, specifically pigs and rabbits, there is oral uptake and then the primary replication happens in the liver and the lymph nodes. And then there's a viremia and there's a slow spread to the muscles, i.e. the meat. Maternal immunity protects the animals for 12 weeks and then when they're slaughtered at 24 weeks, there's a high concentration of the virus. Animals are asymptomatic. In humans, the virus enters the body through oral uptake, specifically from contaminated pork meat, and the primary replication happens in the liver, and then a viremia occurs and the secondary replication happens in the liver and other tissues. It causes liver damage. For the clinical signs, in animals it's asymptomatic. There's no clinical signs or post-mortem lesions. It's not detectable. However, in humans it causes fever, anorexia, depression and fatigue. There's milder clinical signs in hepatitis A, but there's still vomiting, diarrhea and icterus. In a few cases it's fatal. Men seem to die more than women, and it can be subclinical. And abortion occurs in around 20% of pregnant women. For the diagnosis, look at the epidemiology and the clinical signs in humans. You can do a real-time PCR of the feces, liver, or serum. For the treatment, it's symptomatic in humans, so you need to protect the liver with liver protectants and give antiemetics to stop vomiting. And for prevention, decrease eating raw meat and have good kitchen hygiene. And make sure to clean and disinfect yourself after working with pigs, especially their feces. And there are also vaccination trials for humans. The next disease is chicken big liver and spleen disease. It is not zoonotic and the occurrence is worldwide. For the etiology of the disease, the Avi hepivirus genus has the Avi hepivirus magnicuri. For the epidemiology of the disease, it's shed in feces and it gets into the body through oral uptake. It causes great economic loss. It's found only in chickens over the age of 6 months, so 24 weeks, specifically in broiler parents. For the pathogenesis of the disease, it gets into the body through oral uptake and the primary replication happens in the gut epithelium and the lymph nodes. Then a viremia occurs and it spreads and generalizes to the liver and the spleen. The liver becomes enlarged, inflamed and has necrosis and the spleen becomes enlarged and hyperemic. The clinical signs are present in animals but they're not specific. The mortality can increase by around 1% for every 3 to 4 weeks and the egg production decreases from around 20%. And the animals can become depressed, have ruffled feathers and anorexia, and they can also have anemia. These signs can all show up in the pathology. For the diagnosis, you can look at the epidemiology and clinical signs and post-mortem lesions, but they're not obvious. You need to detect the virus directly using a real-time PCR or indirectly using viral neutralization and ELISA. For prevention, follow the epidemiological rules, such as isolation, all in, all out, and have clean drinking water, and there's no vaccination available.